any visit that doesn't require necessarily a physician laying eyes or hands on a participant is a strong candidate for mobile visits. One that doesn't require extensive testing, so anything like an echo or an MRI, that's usually rolled out. But anything that requires drawing and processing any laboratory specimens is a great mobile visit opportunity. Anything that is doing a follow-up. So if you had a baseline EKG at the site and you need additional EKGs and EEG, those are all great. And then standard dosing visits. So we're very cautious about making sure that the first time someone's dosed with something, if there's a possibility for an adverse event, that's done at the site. But after that, once someone is on a dosing regimen, those are great candidates for mobile visits. As far as the recent trends, I think two that we've heard a lot about at this conference are certainly, people tightening their belts a little bit. I think we've all experienced that, as well as understanding that we have to minimize the burden on the sites. And from my perspective, that makes mobile visits the perfect fit for both. Long-term mobile visits will cut down on trial timelines, which cut down on trial costs, and they also reduce the burden on the site by taking some of those visits, some of those, standard dosing, or some of those visits that could be longer or require a lot of draws, doing them in an alternate location. So it does free up the site to have the time for some of those longer visits or other trials as well. So honestly, I think that mobile nursing visits are here to stay and fit in well with these trends, especially with some of those more fragile patient populations that have a lot of difficulty going to and from the site. We've seen that we've been able to help get some drugs approved because we've been able to get the data that historically those patients are dropping out. We're not getting those longer endpoint samples. And by implementing mobile visits, we're actually getting that data to be able to submit to regulatory agencies to get approval. And so I think that's one example, and usually those are the first adopters, and they've seen it pay dividends. We largely see it in rare diseases, especially in pediatric rare disease. And then we've also seen some great success with infectious disease approvals, especially with the COVID pandemic. There is still concern that if you are showing respiratory symptoms, even if the site is open, don't go to the site, especially if you're in one of these more vulnerable patient populations. And so that's where we've seen the most success recently, but that's also just the nature of the regulations. And so hoping to see even more success as time goes on.